Brian, let's turn the viewer's attention to the spinal joints. We've covered the peripheral joints treatment techniques, principles. We're going to come back to the shoulder, but let's move on to the cervical spine, and principles of treatment there are a little different.
Looking at putting our hands on the spine there, we're going to think about what are we dealing with anatomically, and you can take a look at the slide here, and you'll see on the slide there the cervical spine facet planes are about 45 to 55 degrees. And we're going to want to apply a glide to that in the direction, in the parallel to that facet plane to maximize movement between those joints. There's a couple different things we can do. Let's first talk about SNAGs, or sustained natural apophyseal glides, which is an MWM, by the way, because it's a sustained movement, and then we're going to have them move physiologically. One of the common things we see with folks in the neck, say, is a compressive pattern. It hurts when I turn my head to the right, and it hurts on the right-hand side when I turn my head to the right. So that's a kind of a common kind of compressive pattern. If you look at the slide of the thumb on the spine here, your viewers should be able to see that on the screen there, you'll see that you're going to use the side edge of your thumb on the articular pillar on the side you're interested in snagging. You'll take the other thumb and push through the other side of the thumb, and you're going to glide up toward the eyeball, ipsilateral eyeball, in a 45 to 55 degree angle, mimicking the plane of that facet. And you'll notice that the thumbnail also is in line or mimics the plane of that facet, so you know you're in line. If you try to use the fat part of your thumb or the pointy part of your thumb, you're in trouble. Also, if you've got thumbnails, you can double bill for acupuncture. But generally speaking, it's not something you want to do unless you don't like your patient. So let's go ahead and cut away from this static slide and show you a video clip of a cervical snag. And then we'll come back and talk a little bit more about it.
Pull the cervical extensors to the midline. Utilizing your right medial border of your thumb, glide the facet up at a 45 degree angle. If it is pain-free, have the patient rotate into right rotation. Sustain the glide, snag. As you move into the end range, have the patient apply overpressure to move further into the range. Once again, the snag is applied through the medial border of your thumb into the articular pillar at a 45 degree angle. Patient turns into right rotation. Once again, if there's no pain at the end, you want to ensure that the patient applies overpressure to gain additional range of motion. All should be pain-free.
Okay, Rick, we just saw the clip there of a cervical snag. Now, it's interesting, for a compressive pattern, we're suggesting that a common valuable snag for that would be to, let's say if they rotated to the right, they get pain on the right, and we snag them on the right. But we're lifting up on that right facet. Now, a simplistic view of biomechanics of that joint would lead to some questions at this point, such that if you're rotating to the right, everybody knows that that right superior facet comes down. It slides down and back. So why would you lift up on it? So that's kind of a common question that we get. So what's the thinking there?
Yeah. I'm going to actually, since you use your hands, I'm going to make you C5, okay? My hands
Can I be C4? I'd rather be C4.
No, I think you have to be C5 for me.
All right.
Okay, C5, I'm going to be C4. If we are already in right rotation, which means that C4 is dropped down and back on the right, and hypothetically, if we say now, Brian, turn your head to the right, and as he goes and moves to the right, it forces C4 further back and down. Now we basically have a positional fault that we could correct because they're already in right rotation. They're already in, as Brian said, a compressive pattern. So we want to make sure that we could bring the right side back to a neutral position, and this is where we would utilize a unilateral snag on the right. Again, the positional fault, C4 back and down on the right, inducing the pain on the right side. Sustain the glide to bring them back to a neutral position, and here we go, Brian, you turn to the right, C4 goes and C5 goes, and we're all happy. Happy. Brian, we just finished talking about unilateral snags on the right side. Helpful if you have pain on the right side, go to the right side first. So when the concept of a central snag, what is that, and when does that come into play?
you've got multiple options with snags. You can do central snags, you can do unilateral snags, and it really kind of depends on the patient presentation and your clinical examination. Eh?
Right.
So my thinking is if you've got central pain or bilateral pain, that's when I might want to start with a central snag on the spinous process. However, if I have unilateral pain, particularly a compressive pattern, then I may want to go with a unilateral, ipsilateral type of a snag. And that tends to be where the money is usually in my clinical practice. So does that mean you always have to start there? No. But that's just a common place to go where you're going to maximize your efficiency in the clinic. And we all work in busy practices, so the quicker you can get on it and get on with it, the better off you're going to be.
So a clinical presentation might be someone looking up at the ceiling and exclaiming that they had more central pain than a unilateral pain.
Certainly, it could be a sagittal plane motion, flexion or extension. It could be rotation as well. But you may want to get, if you're going to do a central snag, you're going to get the side edge of your thumb on the spinous process in this case, and your thumbnail is going to slope in the same direction as that spinous process. And then the other thumb is going to push through and overpress kind of up toward that eyeball again in the plane of those facets. Now, it doesn't matter for a central snag to which thumb you have down first. It really doesn't matter, whichever your preference is. Now, it does matter if you're doing a unilateral snag. So if I'm going to do a snag on the right facet, I'm going to use the right thumb down first and push through with my other thumb. If it's on the left side, it'll be the left thumb down first and push through the left thumb as well. So a snag is an MWM.
Right. That is correct. That is correct. Sustained glide, not an oscillatory glide. We're going to use that natural facet plane to glide parallel to the joint surfaces, sustain it, and have the person perform the active movement. So this is an opportunity for us. We have another video clip that we would like you to watch, and you'll hear us describe a central snag for a loss of cervical extension. When applying a central snag to the cervical spine for extension, overlap your thumbs. Using the medial border of your thumb, apply the glide at a 45-degree angle. Notice in the clip that the person looks up, and we're sustaining that glide the entire time, not blocking the motion. So as it loops through again, notice again, take up the soft tissue slack, apply the glide, and adjust your hand so that you move with the motion. This is a situation where overpressure is typically not applied.
So what about that patient, Rick, where you put your hands on them, they're very sensitive, even just light touch is uncomfortable for them, but you know they need some sort of bit of manual therapy. What do you do for those folks?
Right. You just hope that patient's not the first patient you have at 8 o'clock in the morning when you reach over to do your initial palpation and you just simply go to touch the back of the neck and the person pulls away and tells you that hurts. Well, part of your assessment is you want to apply an accessory glide to see whether the technique might be indicated, and all of a sudden you got to deal with somebody that has very sensitive skin. The pain neurophysiologists have taught us to think about the possibility that a true neurophysiological problem exists called allodynia. And it is a term that I think physical therapists should know. That is, when you touch somebody and the response is, light touch should not cause pain, but if you touch somebody and it causes pain, you have to deal with that within this concept. So what we have all come to realize is that sometimes bringing out a small foam pad and it simply maybe bias the patient a little bit. Oh, let's see if this helps. And I might put the pad on the back of the neck in order to apply the glide through. I like the use of the piece of foam in that it actually gives me a little bit of friction, but I think at the same time it decreases some of that adverse neurophysiological activity that's going on.
I think that brings up another good point, because a lot of times even if it's a peripheral joint and you get a hold of that finger and you're putting their fingers on there and you're moving the joint and you ask them, does that still hurt? Well, yeah, that's sore. Well, is that the pain you get when you flex? Or is that the pain you get when you rotate your head? Or is that just pressure of my finger? Right. No, that's just pressure of your finger. That's when you can make a distinction. Here, there's your pad. Right. How is it now? How's that pain? Oh, now I don't feel it. That's fine. So you got to make a distinction between their pain and just pressure or discomfort of a placement of a finger or a thumb on their tissue.
Excellent.
So, moving along then, let's go ahead and talk about what we're going to do.
Okay. So we've dealt with the concept of people that are sensitive to touch We've done some manual techniques, and as we've learned from Brian Mulligan, is that if you're treating somebody and you're very successful with a manual snag, teach them a home exercise. Teach them a self-snag, okay? And Brian lightheartedly refers to these as
revenue-reducing techniques.
Why is that?
Because if you can teach them to take away their own pain, they don't keep coming back in and you know, charging more on physical therapy account.
I don't think my manager is going to like to hear about this, but that said.
Well, I work in a very busy clinic, and you know, I see 16 new evals a week, and so I've got to find a place for them. And so for me, if I can teach them to do something at home that's going to get rid of their pain, I'm happy. I've got plenty of people on my panel, and I don't need more. So
we're talking about a self-snag now,
yes,
right?
Yes, absolutely. Now, we just spoke about and showed you the clip for cervical extension snags.
Right.
And now, could you see any problem with your thumb on there as they work into extension sometimes?
If you look at the anatomy, and especially of the cervical spine, and you know that if you look at the mid-cervical spine, in particular the spinous processes, these are very small. So as you, even if you endeavor to utilize the medial border of your thumb in there, as the person goes back into extension, C4 or C5, whichever you are in, it's going to run into the segment below. It's very difficult to keep the pressure on there. So the advantage sometimes of actually using a towel is that the edge of the towel would be much smaller than the thickness of my thumb. So we're just going to use this little model to demonstrate. And if he thinks about that 45-degree angle, obviously that's done a wonderful purchase on that spinous process, can apply the glide. So same principle, thumb versus the towel. Self-snag, glides applied through the towel.
Let's go ahead and take a look at the video clip of this.
That was excellent.
Mid and lower cervical self-snag extension. Ensure that your patient has good posture when initiating a self-snag. Place the towel edge or strap at the indicated spinal level. It is imperative to teach patients the correct glide angle, which in the mid-cervical spine matches the 45-degree plane of the facet. Instruct the patient to pull the towel gently forward and up at the indicated facet angle and guide their movement into cervical extension. Note that the towel edge is at eye level. The glide must be pain-free and sustained during movement. A common patient mistake is not maintaining the glide angle during cervical extension. Although the glide is initially pain-free, it may become a compressive force if the hands, thus the glide angle, remain stationary.
Okay, so we saw extension self-snag with the towel. Now the towel is also extraordinarily useful for rotation or side bend as well, and other movements. But let's go ahead and take a look at the cervical rotation self-snag with a towel. One of my favorite towel exercises for the neck for increasing movement.
Right.
Okay.
Again, we're going to use the salvage part of a towel as we did for extension. We're going to locate on the appropriate spinal segment. And on this occasion, the patient has their arms crossed. And as Bobby is going to the left, he's going to pull the towel up in the direction of the eyeball with one hand, and the other hand will secure the segment. That's right. Now that comes down onto your chest. Bobby must keep his head up straight, and he puts the pressure on to get those surfaces moving. And as it's through the spinous process, it's going to move the facet on both sides. And he comes round slowly, and he can give his own overpressure because he's pulling on the towel, or he can get his partner to do some more. Keeps the pressure on as he comes back. And you tell him not to side bend, keep it in a pure rotation. And if I ever get a stiff neck, this is what I do.
So Rick, you've seen some very useful home exercises. Are there any resources for people if they're interested in this?
Yeah. The home exercise DVD that is available through iTherapies is a collection of Mulligan home exercises. Not only the digital clips are there, But you can also download specific left and right rotation, cervical extension, fist traction, many of the home exercises. Brian Mulligan's been very gracious in letting us develop this in collaboration with him and iTherapy. So look for that at the end of your course material if you're interested in that particular product.